The opening ceremony of the Tokyo Paralympics is underway, even as COVID-19 casts a long shadow over the Games. Like the Olympics, there are few spectators in the stadium due to virus curbs. More than 4,400 athletes will be competing. Organisers hope that the Games will change attitudes towards people with disabilities. Michio Ishida is just outside the National Stadium in Tokyo. She joins us now. Michio, what have been the standouts of the opening ceremony so far?
Well, we've been seeing lots of color, music, and what's important is that many of the performers are those with disabilities. The Paralympic Committee has said that 1.2 billion people have disabilities around the world. And it's important that many people around the world get to see that those with disabilities can overcome and do wonderful things. And it says that the Paralympic Games will be broadcast to over 170 territories, and many African nations will witness the Paralympic Games for the first time. Now, the Tokyo Paralympic Games were expected to be a big step forward to gain recognition to Paralympic Games and also to those with disabilities. But as you know, there are no spectators allowed. Now, 1 year ago, for instance, before the Paralympic Games were postponed, we hear from organizers that ticket sales were really doing well, that there were many sellout games, but as you see, there are no spectators. But authorities are keen to allow school children into the stadiums and to venues to watch firsthand some of the Paralympians, and so they can share some of the wonderful sights that they will witness and to be able to overcome differences.
Michio, safety in the Tokyo Olympics was a concern, and again here, organisers are confident that the safety of the Games, they can maintain it despite the worsening COVID-19 situation there.
Right. Well, a COVID-19 situation is quite bad here in Tokyo. The number of daily cases is 3 times more compared to the time the Tokyo Olympic Games opening ceremony took place. And another concern is that the many people with disabilities, they cannot wear masks. And some of them cannot sanitize on their own. And they need help. That means they cannot practice safe distancing. So there are many hurdles that must be overcome. And it's really a key person would be their caregivers on how they handle the situation as well. So organizers here are saying that we must be vigilant and we must take precautions and abide by COVID-19 measures. And so we've also been hearing that they're asking for stakeholders to increase the number of PCR testing. It used to be 7 days for some, once in 7 days, once in 4 days for some, but organizers are now calling for many of the stakeholders to undergo PCR testing daily, so they do not infect not only the athletes but also the people of Japan and spread the infection. Because here in Tokyo, we're hearing that medical facilities are starting to be overwhelmed. There are cases of people in their middle age who have not been vaccinated, dying. And also we've heard of a woman pregnant. She delivered at home because no hospitals would take her in. Her baby died. So the situation is becoming serious in Tokyo. Meanwhile, the Paralympics takes place.
And safety must be paramount in those Games. Michio, thank you very much for that. Michio Ishida there in Tokyo. Now, we'll have coverage of the Paralympics here on CNA TV for the next couple of weeks. In Singapore, there's also live coverage on MeWatch. Plus, you can keep up to date at cna.asia and on the CNA mobile app.